Did you need to do anything prior?
Yeah, I'm going to do an introduction here. Welcome to everybody to our go-to meeting for August. We were on hiatus most of the summer, but we've got everybody back here and we have some unbelievable stuff happening. And we're so excited to have Stacy with Citizens here with us. We have Michael Singer on board here and Ron Report. And did Brett Miller ever get on here? He was trying to get on from work, so I don't think we got Brett. But the only thing that I want to quickly talk about before I turn the stage over to Stacy is we're so excited that we have the Male Breast Cancer Conference. We've just announced 2020, and you'll be seeing a lot more. And I'll be shooting out an email this evening. It's going to be right here in Kansas City. Everybody gets to come back to our home here. We're going to have a blast. We're going to kick off the day with evening on that Thursday as everybody arrived right here at the house for Mama Burgers. So everybody can finally get a taste of Mama Burgers. And we have got a weekend plan. So if you're not here, you're going to be sorry. And Stacy, we're going to get Citizens here too, we hope, for you guys to be talking to us too. Our speaker lineup is just growing leaps and bounds. So we will actually have all day Friday and Saturday with speakers. It's just going to be amazing. So mark your calendar, April 23rd through the 26th, 2020. If you're not here, you're really going to miss out. But we will also run stuff live from the meeting. But being here is where it's at. So without further ado, oh, one more thing. Sherry was going to get on the call, but she didn't. But she has been writing diligently for our proclamations, and they're starting to come in groves. I've just set up the album for 2019, and we have 4 states on board right now that have sent their proclamations. Arkansas, Mississippi, Louisiana, and Tennessee have sent back proclaiming the 3rd week of October, Male Breast Cancer Awareness Week.
Wow.
So it's really lining up, and I'll share that in the email to everybody too with the conference. So without further ado, Stacy, I turn over the day and the evening to you.
Thank you, Peggy. Wonderful to see you again. Wonderful to see everybody that's sharing video. For those of you who don't know me, I am, sounds like some static.
Yeah, we get everybody to mute if they can. Mute your phones right now.
I work with a company called Citizen, and I'm the Director of Advocacy and Engagement for Citizen. I'm also 6 years out from my own breast cancer diagnosis. And again, for those of you who don't know, Citizen and the Male Breast Cancer Coalition are now partners. And so I'm going to take a little bit of time today to talk about a few things, what Citizen does, why we do it, and why we're excited to work together with the Male Breast Cancer Coalition. So first and foremost, and just by way of introduction, starting with cancer, we really want to empower individuals with their personal health data. And if you look to the far right of the screen, the smiling man with the smiling woman, the man is Anil Sethi, and he's the founder of our company. And with him is his baby sister, Tanya Sethi. Anil has been in the digital health space for a while now. And about 4 years ago, his baby sister was diagnosed with de novo metastatic breast cancer. At the time, he was focused on a digital health app that was helping people get their data, the portal data, things that normally you can log in and kind of get your health records. That company was successful. He sold it to Apple. That now powers Apple Health Kit, which is fantastic. He needed to take a leave from that because Tanya got worse. And so he traveled the world really and helped Tanya get the best treatments that were available. And ironically, his biggest complication in helping her get the best treatment at the best time was getting all of her health data in one place so that they could move to the next thing, whether that was a clinical trial or compassionate use. Tanya died on September 11th, 2017, and Anil made a promise to her that he would take down cancer. His words, not mine. The only thing he knows how to do is start a company. And so he started Citizen with that goal in mind. The second hire for Citizen is the woman in the middle. Her name is Devin McGraw, and she was formerly the Deputy Director of Health Privacy at HHS, and she wrote the guidance associated with HIPAA. So she's on our team, and she's really the one who's helped us create the framework for how we help individuals get the health data that is so important to them and that is rightfully theirs. On the far left, the woman on the far left with no hair is my mom. She was diagnosed in January of 2013 with breast cancer. And the woman next to her with a pink streak in her hair is me. I had taken a leave of absence from my job in California to fly back and forth between here and Texas to help her get through surgeries and through chemo. About 2 weeks after this picture was taken, where I was back in Texas, I flew home, had my first mammogram, and I was diagnosed with breast cancer. So just a little bit of an illustration that this is much more than a job for us. This is actually a true mission. So today we're going to talk super briefly. I'm going to run through a bunch of slides, mostly just to be illustrative so that when we talk about health data and the value of health data, we know that we're talking about the same thing. I'm going to focus a little bit on the patient right of access under HIPAA because that's fundamentally how Citizen operates, and that's how we help remove the friction from individuals getting access to their own data. And then I really want to focus on the Citizen and Male Breast Cancer Coalition partnership, why we're partners and what we hope to do with that partnership. And then it's a small group, which is great because I'm happy to stay on this call as long as possible and answer any questions you might have. So with that, health data. So a lot of times when people think about health data, they think about their medical records. That is 100% accurate. It absolutely includes your medical records, but it includes so much more. If you've ever had an X-ray, a CAT scan, an MRI, a PET scan, that is considered health data. All of your laboratory results, all of your surgical reports, any genetic or genomic or biomarker testing you've had, that is all considered health data. And it's available to you because it's yours. The value of that health data, and if you've obviously been diagnosed with or treated for cancer or really any condition, you know that the value of that health data is in the ability to improve your own care coordination. When you have a conversation with a new doctor or a specialist, to have all of that information in one place really kind of accelerates the ability to get to the meat of the situation. Having all of that health data can facilitate a second opinion, can help empower your family caregivers. A lot of times when we're sick, when we're going through treatment, we're not always able to be our best and strongest advocate. So we need to empower our family caregivers to help us with that. We can also use this health data to share with clinical trial matching services, to submit to a virtual tumor board service. And then my personal goal is that for those that are interested, we can take all of this rich data and share with advocacy groups, share with registries, and really accelerate research so we can start to figure out what the best treatments are and ultimately how we can remove cancer from the picture altogether. So that brings us to the right of access under HIPAA. As I mentioned, fundamentally, that is how our organization operates, is we help you get the data that is rightfully available to you. So what HIPAA says is that you're entitled to all of your data. You're entitled to that data in the preferred format that you requested in. You're entitled to it within 30 days of somebody receiving that request and for limited fees. You are also entitled to share that data with a third party. So we're going to go really quickly around the wheel, and I'll dig down just a little bit into each one of these things. All of your data component, this is considered the designated record set. So earlier when we talked about it being your medical record, but also any imaging or lab results, it's also physician notes and your billing records, your surgical reports, everything that is used in determining your care is considered part of that designated record set. Preferred format. I don't know how many of you have actually gone into a physician's office and you say, I'd like to have copies of my medical records, and they say, Okay, here's a big stack of paper. I don't know about you. Paper is still great if that's the way you want it, but I prefer all of my medical information to be in electronic format. And certainly after the cancer diagnosis, when those pages start to get higher and higher and higher, it's mostly just convenience for me in order to store it, but it's also convenience in sharing if I want to go talk to another doctor or talk to a specialist. You have a right to whatever format you request, as long as that entity can readily produce it in that format. Meaning, if you want it electronically and they, for some reason, don't have any computers in their facility, which I don't think there's one like that that exists, then technically they don't have to give it to you in that way. The thing that's important to note, though, is you cannot force a health institution or a healthcare entity to accept a format that might cause them security risks. So while you can have your information sent electronically to you, you aren't necessarily going to be able to walk in and give a thumb drive to that office and say, I'd like all my data on here. And the reason is there could be something on that thumb drive that then infects their computer. So that's really the leeway that they have with regard to that. You have a right to this information within 30 days from the time that they receive the request. And so this is really important because if a facility tells you that you need to come into the office to make that request, or you need to mail in a piece of paper to make that request, they are actually not in compliance with the HIPAA right of access and the HIPAA privacy law. You can request this information over the phone. You can request it electronically. The thing to know about over the phone is they have the right, and you are probably glad that they have the right, to make sure that you are the person that you say you are. And so you may need to take a picture of your photo ID, fill out a form, and email it to them. But they cannot require you to come into the office because that might delay that 30-day start period. You're entitled to this for limited fees. And I just spoke with somebody yesterday who said, yep, it's $1 a page. That is not right. That is a violation of the HIPAA right of access. They can only charge you reasonable cost-based fees for labor in giving you that record. So if they are going to copy it in paper, yes, they can charge you. However, you can walk down to Kinko's and get a copy for 10 cents a page. So they cannot charge you $1 a page. Most importantly, because you can request it in your preferred format, if you want it electronically, they can only charge you the labor for taking a file and dragging it onto whatever they're going to send it to you. So those fees should not be exorbitant. And then you have a right to request that that copy be sent to a third party. So that could be a family member, it could be another healthcare provider, it could be a clinical trial program, and as we'll talk about, it can be Citizen. That would be how you would get your records into the Citizen platform. All of the same provisions apply with regard to timing, to fees, to form and format, and the comprehensiveness of the designated record set. Your family members also have rights if you choose to give them those rights. And I don't know how many of you have actually signed a HIPAA right of access form, but you can call a family member, you can name a family member and give them the power to make medical decisions on your behalf or to give them access to your data. What's important to note is that doctors and hospitals are also permitted to share this information, but sharing is only permitted, not required. So you can run into situations where facilities don't necessarily want to share with each other. And that's why we're excited to get that data in the hands of the individual, because we get to share it with whomever we want. Can anybody say no? There are very, very limited exceptions to what we just walked through. One of the biggest exceptions is within a research environment or a clinical trial. If there is a research study ongoing, then that information is considered part of the research study and is not considered part of the health data that you have a right to access to. Beyond that, the information has to cause you serious physical harm, and serious physical harm is not a concern that you might be upset by the information. So it's kind of along the lines of, you can't handle the truth. That is not an acceptable reason to deny you access to your health data. Also important to note is they cannot require you to give a reason for wanting your records. They can ask, but you can say, you can make something up, or you can say it's none of your business, or you can give them the reason, which is you would like to have control over your own health data. Also important to note is they cannot deny you access to your health information because you haven't paid a healthcare bill. An outstanding balance with a healthcare institution or an organization does not give them the right to deny you access to your health information. So, why are we excited to work with the Male Breast Cancer Coalition? Actually, before I go there, are there any questions around HIPAA right of access on the phone? I'm going to take that as good news.
Yeah. Is there any cost to me to have you guys hold my records? Because I have already in San Diego. I've got a similar thing that's already being done through Sharp Memorial Hospital, and my doctor who's associated with Sharp. I think it's called Follow My Health. I think it does the same thing. So is yours different?
So ours is a little bit different. First of all, there's no cost to patients ever. We are, helping individuals get their information, but this is information that would be available to them anyway, and giving you a safe single source of truth place to store it. It sounds like your facility is fantastic around giving you a place to go through and understand your health data as it relates to the experience at that facility. One of the differences, and again, not knowing the facility which you speak and not knowing the platform of which you speak, I can't say for sure. But in the cancer space, a lot of times we're treated at multiple facilities. So one facility might have a really expansive portal that we have access to. Another facility might have their own portal. The sharing of that information doesn't frequently happen. And so what Citizen is hoping to do is help you aggregate all of that information in one place. Does that make sense?
Yep. All right. Thank you.
Stacy, this is Jake. If there's no charge, to put it bluntly, what's in it for citizens?
So the revenue model for Citizen and the business model for Citizen is actually outside of the patient space and outside of the advocacy space. So what we're hoping to do one day is to create a marketplace. I don't know how many of you know this, but when you go into a healthcare institution and your data is living in that healthcare institution, very frequently that information goes out the back door. Meaning it gets de-identified. So all of your personal identifying information comes out of it, your name, your birthday, your zip code, things like that. And it gets sold on the market because this is how people want to do research. Records can go for $5,000 a pop. And that's an exchange between a pharmaceutical company and a healthcare institution, a research entity and a healthcare institution. And as patients, we see none of that. Personally, I don't need to get paid for my health data, but I know that a lot of people would like to. Knowing that when you have a cancer diagnosis, you are 2 times more likely than the average person to declare bankruptcy. We know that financial toxicity is an absolute side effect, late and long-term side effect of a cancer diagnosis. At Citizen, there is no back door. There is only a front door. So we use the front door, meaning the HIPAA right of access, to help you get your information, and then your information stays within Citizen. If at one time or another you would like to share that information, there's 2 different scenarios that you have, right? Or 3 different scenarios. You can share it obviously with your care teams and people who are helping you navigate your own disease. You can also share it with advocacy groups, and that's one of the things that we're excited to work with the Male Breast Cancer Coalition around. But then there's going to be, and again I say going to be, the opportunity to share it with the marketplace. When you think about how research gets done, and pharmaceutical companies, diagnostic companies, big research organizations that have money, that have been paying for backdoor information, we are confident that they're going to want to come and help, look into Citizen and say, oh wow, you have a huge cohort of male breast cancer. How can we how can we do some studies on that? And we're going to say, we're absolutely happy to help you do studies on that. And we will broker a relationship between the individuals who want to participate and the institution that wants to pay for that participation. So one of the fundamental principles of Citizen is that if we get paid, you get paid. So individuals who want to participate in this study there'll be a model, and again, this is all being built right now.
Right.
That says, hey, you can share your information, and this is the financial compensation you'll have, or it may not be financial. It might be access to a specific diagnostic test, genomic, something like that. Does that make sense?
It does, Stacy. I gotta say, it's what we do when we get the studies coming to us to say we need to talk to your guys. I then in turn put out a blast of an email or on the brothers page, are you guys interested? And if they are, then I connect them. So we have never ever sold anything for anybody, and we never will, because again, we're families, we're a coalition. We are just trying to get the research, we're trying to get the studies done. So our men don't sit here and, I'm sorry, literally die every time. We have one right now that may not make it through tonight. And this is why we're here right now today, because that helps make the change, guys. And you all know it, being in the family. It's what we can do. But if we can get these researchers and these dollars to go to more research for our men, this is what we're all in it for. I mean, it's what I do it every day for. And I know most of you guys are the same way. And to have citizens being able to pull it all in together in one area where this could continue to help our guys to get further research going on and everything else, I think it's a huge opportunity for us to work together. And you all know I live with Together We'll Change the World, because that's what it's going to take. It's what it's going to take.
Yep.
But to clarify, any information that you share is sanitized to remove any personal information. Is that what you said?
No, I want to clarify that a little bit further. Is this Jake?
Yes, I'm sorry.
Jake, I want to clarify, we don't share any information, period, full stop.
Oh.
Next paragraph, we enable individuals who want to share information with whomever they want. Again, that could be an individual, that could be a physician, that could be a study program.
Okay.
Does that make sense? There is no backdoor.
Yeah.
Okay.
So, absolutely. Are there any other questions around right of access before I go into kind of a little bit more on the partnership?
Can you hear me, Stacy?
I can.
Okay, I guess my microphone was up. Yeah, my question is this just healthcare information when we go to, say, the oncologist, or does this include general practitioners, dermatologists, the whole 9 yards?
All of it. And I will walk you through my profile in a little bit. And if you're all excited, you can see pictures of my colonoscopy, because it's all my data.
Okay.
In one place. That's the beauty of it.
In one place. Exactly. Any other questions?
I think we're good.
Awesome. So why Male Breast Cancer Coalition? Because, and I'm not telling you guys anything you don't know, you are an overlooked and underserved population, without a doubt. And Michael Singer is on the call, and Michael Singer and Patty, they were both in the expo in December of last year when I got into it with a diagnostic company that said, well, we're not going to study male breast cancer because there's not enough of them.
Yes.
We know that a large data set is required to move research. And we know that there is a significant population of men with breast cancer. We have got to bring that together in a way that gets research to pay attention.
Yes.
And that's why the Male Breast Cancer Coalition. Besides Michael and Peggy are fabulous, and I'm excited to work with them. There's also really robust registry opportunities. And so, you know, I mentioned before, we've got some additional advocacy partners. One of those partnerships is with the Cholangiocarcinoma Foundation. Cholangiocarcinoma is another overlooked and underserved population based on the rarity of the disease. They already have a registry, and what we're helping them to do is make that registry a little bit more robust. So super excited to work with Male Breast Cancer Coalition to figure out how we can do the same for you. I'm going to go through this one really quickly, and apologies, it's a bit of an eye chart, but registries exist all over the place, but historically, patient registries, advocacy registries are challenged by a handful of things. One is completeness, and that is because this information is put in at a point in time and not always updated, things change and the registry may not be accurate. The other piece is really around the clinical validity. And I know that some of you probably have met people who have a diagnosis, let's say of breast cancer. They have a metastases, let's say to their lungs, but rather than saying that they have breast cancer in their lungs or a breast cancer metastases, they say that they have breast cancer and lung cancer. When you're dependent on people putting in their own information to the registry, sometimes that information is inaccurate, and even if it's 100% accurate, research doesn't trust it the way that it trusts information coming directly from the record. Really, we want to enable patient-driven research, and that's what, you know, that's what Peggy was mentioning before. I'm going to demo for you, and I'm going to pop out of this really quickly. I'm going to show you two things. First and foremost, I'm going to show you our beta page. Some of you might recognize the handsome man.
Yay, Michael!
So Michael was actually one of our very initial beta users, and he's been fabulous about giving us feedback around the process. He's been fabulous around really just leaning in and helping us kind of test this platform out. What I'm going to show you in just a second is the platform. And I'm jumping in here. So the experience is after you've joined, after you've added your health records, this is what you can expect to see. And this is my profile. So I have some documents in here. One of these documents, if you can see on the far right, is an Ambry genetics report. So this is some genetic testing that I had done because I was diagnosed at a pretty young age. They really wanted to understand why. If I click on that, I can get a preview of it. I can walk through it. You can see. I can also just download it, or I can share the document with somebody. This second document in here is a little bit more unwieldy. So this document has 2,446 pages. This is a huge pull from Kaiser. And because I don't necessarily want to scroll through it on there, I can just download that file if I wanted. And I can open it up. It's a PDF file, and I can go through whatever I want. And basically, this is my, to the person who answered the question earlier, this is not just cancer, right? This is my whole health history.
Right. That's amazing.
I also have imaging studies, and I promised somebody, you can see my colonoscopy. 2 polyps removed, everything's good. But one of the more interesting things, and again, since you guys are all comfortable with the breast cancer space, being able to see my images in the study format that they were conducted in. So this is the needle localization that was ended up being the biopsy that diagnosed my cancer, although you can kind of see some stuff going on right there. And I can do this in my own profile, which again, for me and the team in the office will attest, as soon as I was able to see this was the first time I had ever been able to see the imaging and the cancer.
Yeah, that's amazing.
You've ever had an MRI of your head. So all of this stuff, again, I have it all in one place. I can share it. I can have it. I think it's fabulous.
It's fantastic. I can say this as a mom to Brett, who, as I talk about the younger guys that I talk to all the time,
Yeah.
they don't do this for themselves, okay? I had to take control and do it for Brett, and that's all right because he's so busy living his life at that age. You know, you're young. Women will do it, but I find out that guys will not. This is why this tool is so amazing for them to have it in one place.
Yeah.
I think,
Yeah. I mean, it's super helpful for me. This is the cancer summary view. So all of those health records that you just saw, again, fascinating to go through, fascinating to read through. I'll show you the search in a moment. But really, this is the huge value, this cancer summary,
Yes.
and especially for people who are trying to get a second opinion, who are, thinking about a clinical trial. This breaks everything down with regard to cancer, but it doesn't just do that. It's actually showing me the place in my record where this information was pulled from.
Perfect. Amazing.
So this is the part of the information that is so valuable to research, because now we get to say, okay, let's go to tumor. Well, where did this tumor come from? Okay, here's the biopsy report. And now I can preview it. And so it's saying, okay, this was the size of that tumor, and here's the biopsy report, and that's called data provenance. We can actually see where in the health record that information came from. And again, I can download this file, I can preview this file, I can share this file. One of the things, and so this is the summary view, and then there's also the timeline view. So basically the timeline, this is actually going backwards. If you
Amazing.
want to go through my file like that. And then the other piece that's super important is the care team. When you want to share your information, or if you want to share your information, all you need to do is add a member. You can add a physician if you want to share it with your physician. You can add a physician that you're going to see for a second opinion. Family, friends, somebody who's helping you through treatment. And you get to choose. Do you want to share everything? Do you want to share all your health records, your cancer summary with them?
Excellent.
Do you just want to share that cancer card, that cancer summary? Or do you just want to share a genomics report with them? So I'm kind of all about the everything.
That's
and then
excellent.
I get to choose. Do I want to share it just for 30 days? Again, in the instance of a second opinion, I just want that physician to have, access to it until my opinion happens. Do I want to share it for a whole year, or do I want to share it until I manually stop sharing? And then I just type it all in.
yeah, that's really great.
It's fantastic. It makes life so much easier for everyone. I mean, truly, because it's all in one place. I mean, I talked to two other guys just yesterday because they wanted second opinions. I said, you need to be able to share your records, guys. Request your medical records. Well, how do we do it? I sent them your link. I said, this is how you pull it all together, guys. It'll make life easier. And they're excited about it. So
awesome. Well, I want to show you guys one more thing if you have the energy for it. I'm going to go back to the Michael page, which is what we're affectionately calling this page.
yes.
And just show you how you would sign up if you were interested. So on this page, and I will send this out. So just so everybody's aware, this is not what the rest of the world sees. Right now we have a web form where people can sign up if they're interested. What I will send out to this group, actually what I will send out to Peggy and she can send it out, is a specific link to this page. And that allows you to join the beta directly. So rather than filling out a form that says you're interested, it takes you right to this page where you can set up your account.
Wow.
I know, right, Peggy? This is new.
This is awesome. Yes, it is, girl.
So I am going to
simplified.
And this is the most hysterical part because I regularly get this wrong on the first time, meaning I can't remember the password long enough to put it in two places. I did it.
Good girl. That's awesome, guys. That is.
So this is what happens when you first log in, right? I've given my email address, I've given my name, and I've said, yep, okay, I want to create a profile. And you land here and there's nothing, right? Because you need to get started now.
Perfect.
And you have two choices. You can request your records from a facility, or you can upload your records. Now, for those of you who feel like you have records, if they're from portal pools, they're probably not complete. You probably don't have doctor's notes in there. So even if you have them, I would still suggest you request them.
Yeah.
Sure, we get all of them. That said, if you want to upload them, it's totally fine.
Stacy, it's Michael. Can you hear me?
Yes.
Well, I just wanted to add a couple of things before you moved off that handsome guy on the screen. But
I'll go back.
I'm talking on the phone, so I just wanted to let the other guys know that the issue we had at the San Antonio Breast Cancer Symposium was a great example of how there weren't enough male breast cancers in the cohort. And I was somebody who was taking tamoxifen for 8 years at the time, and the company that had the scorecard of testing your blood to see whether you could come off tamoxifen early refused to take men because he said that they didn't have enough in the cohort, and something like that can make the difference in a man's life if they can come off that endocrine therapy earlier. Another thing is that I felt strong about this because many of the hospitals here in the Bronx that I belong to that had my records were closing. And this was an opportunity to get all my records. They could be with citizen in perpetuity. Did I say that right? And perpetuity. And being able to have those easily accessible, as people mentioned, sometimes you might be at a conference, or in my case, I was at Project Lead, and I had a woman in my group, I won't mention her name, but she was metastatic and she had just several months to live. All of her trials were not working anymore. And one of the doctors who was at that conference wanted to see her medical files to see whether she would qualify for something that he was studying, a clinical trial. And, you know, it took a while until she could get home, get her files, request it, and send it to the guy. Here's an opportunity where you can, within minutes, share it to a researcher or a doctor.
Exactly.
And she met a clinical researcher who actually was able to stop any progression with her metastases and actually reversed it and saved her life. And another thing Stacy mentioned was biopsy reports. You might be in a meeting and somebody says, well, what kind of cancer tumor do you have? You can share your biopsy report right then and there, or, just get involved right away. No timeline is wasted, and it's just an excellent opportunity. That's why I just felt strong about it. And sorry to interrupt.
No, it's an amazing service, and you're proof, Michael, because we were being at San Antonio, we were getting the opportunity to talk to not only, the hospitals and everything, but pharma companies and everything else. And the goal that we have at the coalition is we've got the men. And this is what these researchers and everything are looking for. And so when they find us and know that we're out here, that helps, guys. That's helping to save lives now. And if we hadn't come together, God knows, how many men we'd still be losing on a daily basis. So, and it's much bigger than anybody thinks. I can tell you that for fact.
Thanks, Stacy. Sorry for the interruption.
No, great.
Oh, Michael, interrupt anytime.
Yes.
So I jumped back off the handsome man to the app, just to show you guys that when you want to request your records, we can actually help with searching of facilities. So you can kind of, put this in here, see what comes up. If your facility's there, you can grab it. If your facility's not listed, you can just type it in. And then you type in where that's from and the state.
Excellent.
And push continue. Now this process about your birthday and everything is a one-time process. So many of us have multiple facilities that we would be requesting data from. And I just want to assure you that you don't have to go through this again. I'll show that to you. So you put in your phone number. The phone number is for us. Again, we're not sharing anything. You're the one that would be sharing things if you so choose. The phone number is if we have a question, or if you'll see in a second, we're going to ask you to upload an image of your government issued ID, usually your driver's license. If, for instance, that's not readable, we will call you. So it's going to ask you if imaging was performed. Again, as part of your designated record set, all of the imaging, so your x-rays, your CTs, your PETs, your ultrasound, all of that is considered your health data and is available to you under the HIPAA right of access.
Wow.
Stacy, I have a question.
Yes.
Okay, so what if we were put into a study? Is that information extractable, or is it not extractable?
So if you remember in the presentation, I said that there are some limited exceptions to when a facility can decline to share information with you. And if it's part of an active ongoing research study or a clinical trial, that is not considered part of the designated record set that's available to you. So that information we cannot pull.
Okay.
We're going to ask you here if we should include sensitive record type. So what's considered a sensitive record type is your mental health, any mental health records you have, HIV or AIDS status or test results, any sexual health or reproductive care that you've received, and any substance abuse care. So we default to not requesting these records. If you choose to check any one of these, then we will actually include them in our request. And for a lot of people, the mental health records can be incredibly valuable, especially when you think about some conditions with regard to anxiety or depression, any medications you might be on. I know that, many of you who might be on tamoxifen and SSRIs don't go together very well. So in some cases, you may want to include this information just so whoever the next physician is that you want to share this information with, they actually have the full scope. But if you're not comfortable with that, you don't have to include that. Okay, so this is the photo ID part. I should really bring my driver's license into one of these meetings one day. But right now, I am just going to, oops, the wrong thing. Okay. Oh, I'm sharing my screen, so I can't, I forget. So my computer takes over my camera to actually share my, hold on one second. I'm gonna stop sharing my webcam so that my.
Take photos.
Try that again. Okay, now can you see?
Yeah.
We're pretending this is an ID. And we want to hold it super steady so that we can actually read it, because again, this is what we have to do to prove to the health institution that you are who you say you are, and we're requesting on your behalf. So we can like it, we can hang it, we can go back and we can try it again if we didn't like that version. Okay, let's take that photo. And now we say okay. And now we have to sign. And this is where you're saying that you are giving us the right to act on your behalf. So you are requesting this and we are acting as that third party that's going to get it for you and put it in your citizen profile. It's going to ask you to review the information. As soon as you send request, this is where you have now an option to make a new request or be done. If you make a new request, again, we're going to go through here. Oops. That's not going to be a facility that we find. We're going to add a facility. And then you'll see that all of this information now is already populated. So you don't have to go through it again. It's going to default to what your last request was on the sensitive record type. So if you want to change it at a different facility, you can absolutely change it. It's going to keep your photo ID, and there's no reason for you to have to change that. And then it's going to keep your signature and then you're going to send another request. Make sense?
Yeah.
Okay,
That's
so
cool.
we're sending we're sending this to you, and then you're gonna get the information from them. Is that how that works? Is that what you're saying?
You are sending this to, you are activating your HIPAA right of access through the citizen profile. So what you've just done with requesting those records, identifying the information that you want, uploading your photo ID and signing is basically saying, yes, this is your request and we're going to request that on your behalf.
Okay.
Does that make sense?
Yeah, it sounds great.
Awesome. So I'm going to go back to here. And we've got a few more minutes before the top of the hour, but I just want to let you guys know there will be an email following the webinar with a link. And Peggy, I think it probably makes the most sense just to send it to you.
Yeah, send it to me and then I'll shoot it out in an email blast to everybody.
Okay. And then if you're interested, then all you need to do is go through that same process that I just walked you through, which is basically click on the link, complete your profile information, upload or request data. You can create your profile, you can request your health data from any institution that you have received care for. And I think one of the gaps that we're finding with people who are requesting their data is they forget that genomics information, any diagnostic testing, that's actually a separate facility. So for instance, in the breast cancer space, Oncotype DX and MammaPrint, or maybe you've had an Ambry or some sort of genetics report, that's a separate request. And so you can get that and it will actually get your report back into your portal. You're going to receive an email notification as your records come in. So as an example, if you request from 5 different institutions, you're going to get 5 separate emails as those things come in. If you remember in the presentation, they have up to 30 days. We're actually getting people responding to us in between 5 to 12 days. So those should start rolling in pretty quickly. The cancer summary view that I walked you through, that takes a little while to build, and we won't start on that until all of your requests are in. So while you might get information, if you go in there, that cancer summary view won't be available right away. We need to make sure that we have all the information before we build it.
Stacy?
Yes, sir.
What about dental records? Same thing?
No, actually, no. Dental records are not included under the HIPAA right of access. We are not doing that. Now, there are people who have oral surgery at hospitals, and that's a little bit different. So if you have had what amounts to dental care in a hospital, then that would be part of the poll, but just from your dentist, that's not included.
Yeah, the only reason I ask is I was just thinking of the side effects of some of the chemo drugs or effect on the.
Yeah, and the bone loss. Absolutely. Absolutely. Yeah. You know what though? And again, I'm kind of speaking off the cuff here. I'm just wondering if you had a dental report, you could upload it as an independent document.
True. Absolutely. Yeah. That's not a bad idea.
Yeah, so if we go to the dentist and get the records, we can just manually upload it.
Yeah.
Yeah.
Well, and we'll figure out how to display it. Don't tell my team I said that.
Hey, Ron, it's Mike. The whole process literally took me less than 10 minutes to the photo ID took me the extra couple of minutes, but it's amazing how quick that the requests happen and that citizen gets your information and compiles it. Yeah, it really happens quick.
Sounds fantastic.
That is. And that way more, I'll put not only the email out, but I'll put it to the brothers page also, the secret group. So we can get more of the guys really moving on it, because I think the sooner everybody starts using it, the better. Stacy, how many did ever sign up when we started pushing it out the last go round?
So the only way I have to track is by the unique links I send you. And so I know that there were some people that came in a different manner, and so they're not tracked. I'm willing to bet we probably have about 20 right now.
Cool. Okay.
But again, once you join, I don't know who, you
No,
know.
yeah, exactly. You don't know who. So
Yeah.
it's hard to keep track of it for our statistic basis if you're using it or not. But I guess the more we push it out, the better. You know, it'll just remain the guys.
I think if we can be really diligent about using that unique link, because there's a little,
Right.
then I think we'll be able to track, because at that point we can know where they came from, which is from
Right.
MBCC, and then we can figure out how many of those people actually created accounts.
Because of it. Yeah.
So that should give us at least a good indication.
Excellent. That's it. And again, because I don't know, guys don't respond to me if they've done it. Very few do. So again, we have no way to track it on our side either. So
Yeah.
Stacy, this is Jake again. On the photo ID, do you need to have a smartphone, or can you scan it? Because I don't have a smartphone. I'm low tech.
You can absolutely scan it. Just make sure that it's a quality picture so that they can see all the, so it's not fuzzy.
Okay.
Because again, this is the one proof of identity that the healthcare facility needs to feel confident that this is actually you making a request.
Sure, that makes sense. Okay, thanks.
excellent. And so again, more can be uploaded of reports, especially if you can't get them. Like Michael said, if a hospital shut down or something, you can't get to your medical records. Some of these guys are 14 and 15-year survivors, but they want to use this service. So that would be a way to put it together.
Yeah, absolutely. And I didn't share in this particular one, but when I went back after I was diagnosed, I tried to get records from when I was in Colorado. This is obviously before I knew Devin, before I even understood my HIPAA right of access. And I was told I needed to come into the office. Well, I live now, 1,300 miles away. And so that never happened. Because then when I finally joined Citizen and I finally learned what my rights were, I requested through this process, and I was told that it had been more than 10 years and my records had been destroyed. So,
wow. Yeah. So that's,
the good news is many of us are living longer after a cancer diagnosis.
Thank God.
The bad news is if we don't start to get control and agency over our health data, it might not be there when we need it.
Nobody else will. Exactly.
Yep.
Your own best advocate.
Stacy, what would you given that hospital on the healthcare scorecard for your HIPAA rights?
Negative. For those of you who don't know, we as in Citizen published what's called the patient record scorecard a week ago, and super exciting work. We looked at 3,003 institutions. We called them up and we asked them these hypothetical questions that were indicative of whether or not they were complying with the HIPAA right of access. So that was a survey. But then we actually created a scorecard, and those were institutions where we had actually requested records on behalf of patients between when we started this process and the end of May 2019. We then released the report on how those people did. So they were either 1-star providers, 2-star providers, 3-star providers, or they exceeded the requirements in the HIPAA right of access and they were 4- and 5-star providers. One of the fascinating things that we found is over 50% of the organizations were not compliant with the HIPAA right of access. And so, rather, we definitely don't want to bully institutions, and we're not trying to shame anybody. We're trying to change the system. Citizen right now is focused on cancer, and I explained to you why we created this company in the first place. But the HIPAA right of access applies to anybody who's been treated in the US. So we're going out with these webinars. I did one a couple of weeks ago, and it's to the general community that says, hey, these are your rights. So if you don't have cancer, I can't help you from a platform perspective, but it can absolutely help you from an education perspective and knowing what your rights are.
Excellent.
Stacy, you alluded to the fact that these research companies need so many, records to actually do research. What are we looking at as a number, say, for male breast cancer? I mean, if we get 200-300 guys signed up for this, would that be enough to warrant research?
That would be
amazing. Right now they're doing research on 10 and 20 of you guys.
That
Just
would be
they're willing
amazing.
to do it because they are as hungry to get information as you are to give it.
Yeah.
So
we need to relay that to the brothers.
Yes.
This is in their interest. This is in their best interest.
Exactly.
Absolutely.
To any man out there
Absolutely.
with breast cancer, this is in their best interest to go on
Absolutely.
it, pull it together. Let's get it together because, guys, that's our goal. Our goal that we live with every single day is that list of you guys. And only is shared when you all want it shared. But guess what? That's helping these doctors to do something about male breast cancer. Without it, we don't have shit. That's what I'm saying. But yeah, it definitely makes it's making the difference for all you men. I mean, it truly is.
Ron, you know what's crazy is with over 2,000 guys getting diagnosed every year, that a company can't get 200, 300 guys just to build a cohort so we could be part of a study that would improve the quality of life for men with breast cancer who want to get off certain drugs, whether it's tamoxifen or Arimidex or whatever it is. But to have them tell you no at a conference, I had to hold Stacy back basically from assaulting the owner of this drug company at San Antonio. That the owner of the company actually wrote me a letter of apology the week later. But I mean, he apologized, but he's right. We can't get guys to agree to share their data so that we can maybe improve somebody else's life down the road. It's crazy.
You know, I personally think, Michael and Peggy, that from my perspective, I went to some of these nurse navigators at the big institutions, and I gave them packets of our information. And I said, hey, if you get a guy, and they get them, you know, they told me they get them. Of course, we don't have information. I said, hey, pass this out, and if they feel they want to reach out to us, at least they know we're here.
Yes.
So I think that's where maybe we have to put an impetus on you know, the guys all over the country to get out who can do it. You know, people who, you know, aren't sick and, you know, and not
true. Well, perfect examples. Jake Williams, our 31 new one that just today finds out after his mastectomy, he's not barely stage 1. He doesn't have to go on drugs and everything. And he sits here and he says, and when I first got his message last week on the backside of the coalition, he said, I know you guys have been around. You've been my inspiration and all this, but I wasn't going to reach out to you. But thank God I've reached out to you because it's helped me through it. I mean, you guys saw on the brothers page, he was really depressed and everything that day. He thought about ending his life. I talked to the man for 2 hours that day.
And when I saw that today on Facebook,
with his shirt on,
I said, I'm glad you're okay. You know, I'm glad everything's going to be okay. And now's your chance to go out, help the rest of the guys who can't do it for themselves.
And that's exactly it, Ron. I mean, he was the first to say it, and we were going back and forth private messaging again today, and he goes, I can't believe how far I've come in 4 days.
Yeah.
Wow.
So it made a difference in this poor man's life when he didn't think he was going to continue last week.
And I think the more guys we can find out there, better for us.
Oh, for everybody, everything concerned. The more we can continue to bring them together, the better for everyone, because it will help the medical community. It helps them as a human being. They realize they're not alone. And, you know, bottom line is be what the hell? Be proud of it. Share it. You know, what's somebody going to do? Who was it that said they went into it was Larry Overcast. They went into Popeye's Chicken with their shirt in, and all the people could do in line is laugh. They were literally laughing at him, thinking it was a joke. And he said, this is not a joke. And he pulled up and showed his scar and everything.
Oh, wow.
Yeah, and he just finally said, and there was still one young man that continued, oh, this is really a joke. And he says, no, it's not. And I hope to God it never happens to you. But just remember this day, you've met someone And this could help change many people's lives, and it could be your own family or yourself. And, that makes a difference.
I need to go. I need to pick up a go. I am going to send all of this information to Peggy.
Good.
I also, because I live on one coast, if you need any help with the proclamations on the West Coast, let me know.
Oh, we will, Sherry. Yeah, absolutely. Excellent.
Okay, and I'm happy to help. And I'm also going to send, Peggy has my email address. It's just my first name @Citizen, but my first name is STACEY, and Citizen is spelled with 2 I's.
2 I's, yeah.
The only one. But I'll send all of that out. And so let me know how I can help, whether it's another webinar, whether it's materials, how I can help people feel comfortable that this is something that really can move research forward.
Absolutely. And Jake?
Yeah, I know you need to go, Stacey. 2 things. First of all, is this open to prostate cancer also?
Absolutely. So what I was mentioning to Peggy is when we first did this webinar, we were only working with breast, pancreatic, and lung. A few weeks ago, I sent her a note, super excited. We are now open to all cancers. So prostate cancer.
That's why you're working with Len.
Yeah, exactly. It is. And so why don't we put that in your paragraph to all the guys, Stacy? Let them know it's all cancer, because many of our guys are breast and prostate cancer survivors.
Oh, wow. Okay. Absolutely. Yeah. I will.
And second question. I'm going to put, we're recording this, so I'm going to put it on YouTube. I had to make a little introductory video, which links to the actual recording. It's just some kind of crazy internet rule. But when I make the introduction, how do I pronounce your last name?
Tignano. The second I is like a Y.
Tignano.
Yeah.
Perfect.
Okay. Thank you.
You guys are awesome. This is amazing. I think we made a huge headway here, and I understand it so much more now. So thank you all. God bless. See you next month. Bye-bye.
Bye-bye.
Take care, guys.
So I'm going to stop the recording now, Peggy?
Yeah, that'd be great.